Training for a nurse. There are variable entry levels. It's changing a little bit now with the Institute of Medicine is really kind of evoking a change in a higher level preparation. But you can be an associate degree nurse, which is usually 1.5 to at most 2 years. It's more intense clinical practice in the acute setting that you'll be working on versus not so much theory-based. You can have a bachelor's degree, which is a 4-year program, which is heavily theory-based in connection with clinical practice time. Master's prepared. Most bedside nurses, I will say, are either, if you're 20 years plus, there's a chance you're associate degree, but I will say the past 10 years, the push is, and we will only hire, and most hospitals now will only hire if you have a bachelor's degree. So we have a lot of nurses that have been doing it for 30 years, going back for their bachelor's degree so they can keep their job. We've got people who are master's prepared. Typically, if you're master's prepared, you're looking for a little more than the bedside work. You're looking for more leadership. You're looking for being a change agent, quality improvement, education, management. Those require a minimum of a master's degree. And then you go as far up to a doctorate degree or a PhD. So PhD in research is common in nursing. And that is basically to help translate evidence-based medicine into the practice. And then your doctorate prepared, your what we call a DNP, which is a doctorate of nursing practice, is additional. So that's the same amount of training that a physician would go through. It's 8 years of school in total to get a degree like that. If you take a 4-year bachelor degree and then add on your doctorate program, it becomes a combined master's doctorate program. So a lot of education has gone into some of these nurses. Some not as much heavy theory-based, but extreme clinical skill-based set. There are different levels. There is a CNA, which is a certified nursing assistant. There's an LPN, which is a licensed practice nurse who works in conjunction with a registered nurse. And in a hospital setting, a registered nurse is used differently than in a long-term care setting. In a long-term care setting, a registered nurse is usually case management, where in a hospital environment, that's direct patient care. So typical, I would say, is a 4-year degree, is the most common thing that you'll see for a nurse. Advice for undergraduate students interested in nursing: do it. Absolutely do it. It's a fantastic career to have, one for its flexibility. You can be a nurse from anywhere from clinic setting, doctor's office, long-term care facility, outpatient areas, in-hospital settings, different roles as I said, educator, manager, nurse practitioner, certified nurse anesthetist. I can work in the operating room. You can do so many different things. So if you get bored with what you're doing, you can change it up. There's not a lot of professions that you have that opportunity. The beauty of working in critical care, for me, full-time work is 3 12s a week. So I work 3 days out of the week. So that allows me to have work-life balance. It allows me to have time with my family, to exercise, to do things that bring joy to me, so that when I'm at the bedside, I'm filled up and I feel great. It's a role that is really becoming much more respected as a true player at the table. I will say even 20 years ago when I first started, there was quite a hierarchy, and that's narrowing now. Where nursing, you can really create it to be whatever you want it to be. In my space, I like to play in a simulation lab where I can help facilitate knowledge gaps and I can build critical thinking, but we're not going to harm anybody. It's a safe environment to grow and to learn from. You can work in labs, you can do so many different things, and I love that flexibility. And it ebbs and flows, and you can use it as you need to throughout your life. And I really don't know a lot of professions that can do that.